Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President, CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS. In 2019, after a 2-year rebranding process and 32 years of service to the African American community, the National Black Leadership Commission on AIDS became known as the National Black Leadership Commission on Health, Black Health. Our mission is to champion promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. Our vision is to promote the health and wellness of Black communities through education, advocacy, and policy. This was a major development and organization evolution that moved beyond HIV/AIDS to address multiple health issues and disparities disproportionately affecting African Americans. So with a new vision, Black Health expanded its health focus areas to include HIV, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health, all of which affect African Americans at vastly disproportionate levels in comparison to other racial ethnic groups. Today, we will highlight the importance of health justice in relation to maternal health through the perspective of a community, a father who has lost a loved one due to complications after childbirth. I am pleased to be joined by Jose Perez, a Brooklyn resident, father of 3, who is advocating for justice after the loss of his beloved fiancée, Christine Fields, due to complications after giving birth to their son on November 12, 2023. Jose has 3 children, ages 5, 3, and 2 months old. So just before hearing about his experience and from him, I want to make a few comments worthy noting as it relates to the problem dealing with maternal health. I think it's rather astounding that when we think here in this country, the United States, that more than 800 women die annually from pregnancy-related complications. Black women are 3 times more likely to die from pregnancy-related complications in this country than any other racial or ethnic group. And here in New York City, Black women, Black mothers across all the 5 boroughs are twice as likely to die during childbirth than white mothers. That is why we are here today, to explore this issue much further and to come up with some action steps. How can we advocate more fully and educate our community and medical providers about the impact and what we are seeing through the work that is done through Black Health and our talking with our various guests. So, Jose, Mr. Perez, I am so delighted that you agreed to join us today, knowing that you are still dealing with the loss through your own personal grief and having 3 children in the household also now, that you are having to certainly care for, and bring them through the loss of a mother. So we continue our prayers and condolences for your strength, your comfort, and your peace. So thank you for joining us. And what I'd like for you to do is to kind of just tell us a little about Christine and your journey to welcoming your third child. Bring her to life for those of us who unfortunately did not have the experience or the opportunity of knowing us. Sure.
First of all, I want to say thank you for having me here, Ms. Fields. Appreciate it. It's very hard. I get emotional still.
And we understand it, and it's really okay, because this is not, an easy thing, I'm sure.
I'm going to try my best to, to just... Okay, Christine. A little bit about Christine. Christine was a daughter. Christine was a sister. Christine was an aunt. Christine helped in her community. She helped as far as with in the building where she lives, public housing. She helped older senior citizens. She was on the board with her mom's, community board to help people. Christine made various phone calls to housing multiple times, to hot water, things in that nature. That's who Christine is a little bit. Christine worked since she was 15 years old. Christine went to school, graduated, got her bachelor's in criminal justice of science. She just graduated in July, had her graduation of 2023. Christine was at the start of her career, basically. Christine definitely had a career up ahead in front of her. She knew what she wanted. Christine is a great mom. Our oldest son, Liam, 5 years old. Our daughter, Nova, she just turned 3 on December 3rd. Just split an image of her mother, just a little lighter. She loves her mom, she misses her mom so much. Christine loved family. Christine loved to just help. You can go to Christine Booney Fields' Facebook. You can see the love and support she gets. Christine always advocated for people to how to get jobs, always help somebody get a job. It's just a little bit about Christine, who Christine was.
Yeah. So now let me just ask, during this very difficult time and period now, do you have family and friends who are surrounding you and giving you the support that you still need as you go through this difficult period?
Yeah, definitely. I definitely have her moms. I have her sister. She has other family members that are definitely supporting and helping. I'm the youngest out of 10 from my side of the family. So I definitely have a big family. I definitely have a lot of sisters that come out. I got 5 sisters, so all my sisters is like they're like, since my mom's passed away, my dad passed away, I'm the youngest out of 10, so my sisters basically became mother figures.
Youngest out of 10, wow. Yes. That's amazing. I'm the youngest out of 5, but you have me double 10. Yeah. Wow, that's amazing.
So at this time, it's a blessing to have them.
Yes, absolutely.
At this point in life, at this time, it's definitely a blessing to just have so much family.
Yeah, no, I asked that because it is so important that, when we have challenges and we're going through difficult periods, to be surrounded by family and friends can make a big difference. So I'm happy to hear that.
It definitely does. It definitely helps. Definitely helps because, like, having a baby, you expect it to be a 2-partner thing. So when you go home with just one spouse, it's just one spouse that goes home with a baby. It's very difficult.
Yeah. Okay, let me just say, based on what we understood about the process, that we understand that Christine had developed a rather detailed birth plan prior to being admitted for labor and delivery. And as you talked about her in terms of a person and how much she was, a detailed person, even in working through the housing development and helping other people. That didn't seem much of a surprise that she had developed a detailed plan prior to. So what role do you think inequities played, such as medical bias, or how is it that Christine ended up not coming out of this, given that she had developed a plan and had been discussed?
Okay. See, I think that comes down to medical communications that go on in the hospital, lack of communication that goes on in the hospital. Could there have been bias? Could there have been some racism? Yeah, there could have been some racism, because me and Christine were at the hospital in the morning, and we ended up leaving the hospital because Christine was told to walk out in the hallway for multiple hours, and we went back in the room. And I would refer to this person as a white lady only because her skin color was white. But then a patient came in there with her mother and her grandmother, and she was a lighter color person, lighter than me. And all the doctors attended to her and forgot about Christine.
And Christine was still in the hallway?
Christine was in the hallway, and then Christine went in the room, and Christine pressed the intercom and asked to speak with the doctor, and the lady at the intercom came off very rude, like she came off, this was her exact words, "What is it that you want?" And it was the first time Christine buzzed the intercom. So Christine's already in labor pains going through her situation. So she decided, I don't want to deal with this, let's leave. So security came up there, we left the hospital. Mm-hmm. All the doctors come out, try to get her to stay, we leave the hospital. We end up going back to the hospital after 12 o'clock in the afternoon. It's still the same group of doctors there, still the same people there. Because somebody felt some type of way that we caused the scene earlier and we left? It's possible. Mm-hmm. Right before Christine went in to do it, right before they took Christine in to do it, not before Christine went in to do a C-section, because Christine objected to a C-section the whole time.
So there was no plan for a C-section during the pregnancy?
No, Christine was 39 weeks. Christine was healthy. Mm-hmm. Christine did not have no issues during her whole 39 weeks of labor. Christine was given morphine while we were at the hospital. Right before they rushed in to do the C-section, the nurse had checked her. She was 6 centimeters open. The nurse looked, she said she's about to give birth. But at this point, the baby's heart rate had dropped. The doctor's in there. He's like, it's 17 minutes, 20 minutes will be too late for the baby. We have to do a C-section right now. I'm trying to explain to him that Christine gets anxiety. Everybody needs to calm down. Christine's trying to do her best to get the baby heart rate going. Mm-hmm. She's on her hands and knees, rotating her hips, trying to get the baby's heart rate going, and things in that nature. They take her to do a C-section. Right before they do the C-section on her, though, the lady from the morning was brought out the C-section area. So the same doctor had just performed a C-section on the lady from the morning, the light-skinned lady, and it just becomes a lot. He could have been tired. It could have been multiple things. Mm-hmm. So it could have been racism. It could have been bias. It could have been just tiredness. I'm not sure.
Yeah, and it's not for you to have to even try to figure out what it was. It is up to providers and medical professionals to be able to make these decisions. First of all, thank you for going into that level of detail, because I know it must be difficult, and you chose to provide that level of detail. And I'm going to ask you also to name the hospital, because I think people need to know what is going on in this city when we are faced with these kind of challenges. Sure. What hospital is this?
This is Woodhull Medical Center. Is located on Flushing Avenue in Brooklyn, New York, 11206.
Thank you.
Yes, definitely. Yeah.
So after the delivery of the baby, did she leave the hospital at any time, or did she,
No, so the baby was brought out. They did the C-section. After ejecting to a C-section, we ejected to a C-section, telling them everybody needs to calm down. I'm there with Christine the whole time. When they rushed Christine in to do the C-section, they didn't allow me in the room with her. For what reasons, I'm not sure. But going back to the patient prior to her, she was there with her grandmother and her mother. The mother was allowed in, and the grandmother waited outside the room. But Christine was wheeled off by herself.
And you were not allowed to go into the room at that time with her. Yes, and I understand that there is a lawsuit now that is taking place, and we allow that to run its course. But one of the things that I, again, wanted to point out is that what we're seeing across this country with respect to complications following, birth, but it sounds like also the complications that were identified even before Christine ended up having to have the C-section was not something that was given a great deal of attention. And, there are a lot of studies and information that speaks to women of color when they say that they are having pain, it is not believed, or when they are having difficulties, the medical attention or the medical providers are not giving them the attention that is warranted. So, even though, as you pointed out, you saw others coming in of a different skin complexion, nothing like that should ever be the case, so that the comparisons or trying to make a determination, why is this person being treated this way and this person is being treated, differently. And
Definitely.
as we talk today, of course, yesterday, we commemorated the life, the birth of Dr. Martin Luther King, who fought for civil rights, for social justice, and health, because one of his major focus was about, people being given access to health care. We didn't get there during his lifetime, but of course, with our president, Barack Obama, the Affordable Care Act at least was passed, and we still find that there are difficulties with women of color getting access to the kind of health care and doing it at a time when it is most needed, like in Christina's case. The fact that you all had to leave the hospital and come back is very telling. So I'm pleased to hear you tell your story, because I think one of the things that we have to remember to do is trying to get through some of this in terms of advocacy and getting some policy changes, is to have people who are most impacted tell their stories just as you have today. And I know that there have been some efforts to try to meet with the governor's office around some policy issues. Can you speak to that?
Yeah, so definitely been right before the holidays. You definitely try to get me and a couple of other grieving family members. We definitely had a little press conference. We definitely went to Governor Kathy Hochul's office to try to hand deliver a letter. We were turned away. We were just trying to basically sit down and speak with her about the Grieving Families Act, why it's so important. Like for me, other families like me, like if you're not in my situation, you probably wouldn't understand what I'm going through. But it's very rough. Like, I used to drive a truck. I can't go to work. I have three babies I got to take care of. One of them is in school because he's 5 years old, but the other two are babies. I'm going through a lot of emotions, a lot of hard times, a lot of stress, difficult. So there should be laws and acts that help families like me. We shouldn't have to go around and try to rely on our community only for help.
Yeah, and I think you even mentioned earlier, too, about the fact that even a birth certificate had not been given to you until much later. And those matters and issues that should not be the case.
Yeah,
When
definitely.
a baby leaves the hospital, you should have the birth certificate.
Definitely, my baby.
You know.
My baby still doesn't have health insurance. I'm still having a hard time getting my baby health insurance, even after everything. Just a small example. I went to WIC. I tried to get my baby WIC. I was turned away because I didn't have all the paperwork. They asking me for paperwork that they know I don't have. I explained my situation.
And one of the things that, again, and this is something that my office will hopefully be able to follow up with you in terms of identifying organizations, resources for, advising on how to proceed on matters like this. Okay, for example, to go to the governor's office to ask to speak to the governor, it's not unusual that would not happen, but certainly who in the office or where are the resources or what departments there can at least say, well, this is where we refer you, making those kind of referrals. So those are some of the things that by telling your story today, I think we'll be able to help try to identify some resources and some referrals for what it is that you're dealing with, even in terms of the emotions, because we want to make sure that you remain healthy mentally, physically, spiritually, and that you're able to provide, for your children. So how are the children doing? Well, the 5-year-old is probably the oldest who might have some memory and thoughts about his mother.
He's definitely sad. Definitely talks about his mom a lot. He definitely understands. She's no longer coming back. My daughter, she just turned 3. It's very difficult for her. Every night since her mom's been gone, she doesn't sleep. She just wakes up in the middle of her sleep every time, just crying. She wouldn't want nobody. She doesn't want me to touch her. She just be hysterically crying. She's constantly like, every time she says something, she just tries to remind you how much she loves her mom.
Right.
So if she be like, Daddy, I love you, but I love Mommy too, Daddy.
Sure.
And Mommy's never coming back. It's very heartbreaking. It's very hard. It's very hard. I can see for kids don't know how to express their emotions. So they could be sad and they don't know that they're sad. So you have to keep an extra eye on the kids because they don't know how to express their feelings properly. Yeah. So it becomes harder for me.
Absolutely.
Yes.
Absolutely. Well, again, as I said, I think, it's so important for you to tell your stories, and hopefully our viewers who are watching this might be able to say, okay, I want to help and I can do this. Let's talk a little about your experiences. Now that you are an advocate, you are using your voice in a way that we look and hope more people who experience trauma, breakdowns, and other issues will be able and willing to talk about it to bring about some change. So what are some of the things that you think needs to be done and ways in which you could use your voice in this situation?
Well, I'm definitely gonna use my voice and Christine's story to try to get as much possible as change as we could in the health system, in just laws and acts. There's so much other ways that people just could help out. Like it's just necessarily not money all the time. It's just I have on my Facebook. I have on Jose Perez Facebook. You can find me on Facebook. You can find me on Twitter, Jose Perez 718 Brooklyn. I have a group of people. I have groups of people there that are trying to pass laws that are teaching people. They giving classes. They how to where you could sign up to do this. How could you help? It's not only about money. Everybody doesn't have money to share. So people have time. And there's a lot of people that have time. And there's a lot of people that be on social media just sharing the hashtag Justice for Christine Fields, hashtag Justice for Christine Fields. Helps.
And I see that you're carrying her picture with you. You are doing that in different locations and spaces, correct?
Yes, definitely.
Mm-hmm.
I definitely am. Definitely going to continue to carry her pictures. Definitely going to continue to say her name, Christine Fields. Definitely, she still would have been here with us. Unfortunately, we're going through what we're going through. It's so sad that we have to go through this. Like a whole report, a newspaper came out yesterday done, by Joseph Goldstein, New York Times. Some stories just
About
a
the
lot of people.
situation.
Yes,
Yeah.
it's about Christine Fields, about the hospital. Story's hard for me. A lot of people read it, call me, take in. Hey, you see what they said in the story. It's just the type of negligence that happened
Right.
to Christine.
Right. Well, I would encourage you to continue to tell your story. And I tell you, we are so appreciative that you came to talk with us today. And I want to certainly thank you for joining us today. And we continue to express and extend our condolences to the Fields family and to you as each one of you navigate this loss. And certainly your willingness to share your story serves as an inspiration to us when learning how to be an effective advocate for others. And additionally, your experience highlights the disproportionate high maternal mortality rates among Black women and how maternal health impacts the family overall. So, referencing your journey, we can now uplift it to the work of supporting maternal health matters with those closest to us in our communities, as well as holding stakeholders and policymakers accountable so that we can correct inequities and outcomes. So for more information about Black health, please visit our website, nblch.org, and look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to become better informed about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this programming. I am C. Virginia Fields, and I thank you for joining us, and I thank our guests and hope that you will join us next time for Health Action TV here on Manhattan Neighborhood Network.